Could you please introduce yourself and where you are from?
My name is Danielle Mintsoulis. I'm a second-year medical student at the University of Ottawa, Canada.
And can you explain a bit about your research here and the poster you are presenting?
Sure. So my research focuses on pigmented lesion clinics in comparison to a general dermatology clinic. So in particular, we're looking at the use of both digital dermoscopy and full body photography, also known as total body photography, and then comparing that with most general dermatology clinics that use a standard handheld dermoscopy. And in particular, we're trying to see, we know that with the PLCs we are detecting melanomas at an earlier rate, but we want to know just exactly how thin we are. So we're expecting that since we're catching them early, they should be diagnosed at a thinner stage. Mm-hmm. So we did a retrospective chart review. So we took all the patients from the pigmented lesion clinic at the Ottawa Hospital, which was only about 250 or so patients, and then we compared that with a general dermatology clinic in the city that had around 1,300 patients, and they were sorted based on either having a prior history of melanoma or if they had a previous diagnosis. Or if they were deemed to be a high risk of melanoma. Sorry about that. So then we just did just a regular stats on the thing, and we found that at the melanoma, at the PLC, most of the biopsies were mostly nevi, and only about 5% of them actually were diagnosed as melanoma. In comparison to the general dermatology clinic, about 21% were diagnosed as malignant melanoma. And then if we kind of just focus only on the melanoma numbers, we saw that at the pigmented lesion clinic, of the 14 biopsies there, so the 5% total of the study, most of them were diagnosed as in situ, and the one that was invasive was only staged at T1. Versus if you look at the general dermatology clinic, about 60 or 62% were only in situ, and the rest of them were invasive, ranging all the way from T1 to T4.
So what would you say is the implications of these findings?
So I think the goal of our research was to kind of show that using this newer technology does have obvious benefits in improving the diagnosis of melanoma and catching at an earlier stage, especially for patients that are high risk. So, they either have congenital dysplastic nevi syndrome or have had multiple melanomas in the past. It offers a lot of reassurance that, if they're enrolled in these kind of clinics, then maybe we can catch them earlier. And especially for Canada, the one at the Ottawa Hospital is the only one in Canada that's a hospital-based pigmented lesion clinic that uses this technology. So sort of as a long-term goal, maybe it'd be nice to see more centers across the country using this technology.
Well, thank you very much for your time.